what Adhesion Release Methods does is it puts you on the path. So now you just have to follow the steps and be honest with yourself. And the great news is every person you see allows you to then show that you have the skills to get them the results that they need to get out of pain and live their life. So I'm a adhesion specialist. When I was working in cancer research at a local hospital, I was essentially a clinical trials coordinator, which meant we were taking people that had a lot of cancer, determine if they're eligible for cancer studies, take them through the process of a blinded study so they may or may not get a new agent to help them. My role was to help provide the consent and then fill out the forms. So essentially transitioning a person in their case into data points that could be used by the pharmaceutical industry to then show that their drug was effective versus current treatment standards. The biggest problem with that for me was I was dehumanizing the person from them and their family and their life and what they wanted to do versus the data that was being collected. There were two big problems. One was I felt like I was providing false hope because to the person and their family, when they see a clinical trial, their thought is they're going to be healed. Well, we're doing these studies on terminal patients, so that wasn't going to happen. And when a family member would ask me in the hallway, hey, is dad going to be better by Christmas? I was a clinical trial coordinator. That's not a question I can answer. So I had to say, that's a question for the doctor. So I didn't like that false hope. I want to help people live their life. So I was way too late to the game in that role to actually impact people. I didn't like that. So I was like, okay, I can improve on how we work with people. I met Matt and Brandon at early seminars, and Matt was super intimidating at first because he's a very intense person. And there was these legendary numbers about how many people he would see in a week. And we're like, how do you hold up if you're doing that many patients and helping that many people? He is an intense person, which helps him be as good as he is as both a doctor, but also as an instructor. So when I wanted to transition my practice and potentially bring in another associate, I was like, I'm not where I need to be to make this all happen, but we're helping enough people to do that. So I was like, okay, I need someone to help me with this. And so I asked Matt, and I called him and I was like, hey, would you be willing to coach me? He got back to me. He's like, yeah, I'd be honored to coach you. I used to go and shadow Matt and, and learn with him and from him. And then when Brandon came into his practice, it was immediately apparent how much more fun Matt was having in practice with both he and Brandon, and how they were just both having a really good time with their patients. The results just continued to improve, and they're already getting amazing results. The ability to distill it into what's actually happening gave context because Matt's brain works really fast. Brandon was able to help kind of put words to that process and help me come to a better understanding. But I know that every time I go out there, I come back with a lot better clinical skills. And then with that clinical skill comes the confidence and the communication. My practice is so much more fun because I just go in free and say okay, you have this problem. I have some ideas about what may be going on, but when I'm feeling, now I'm just going in there, okay, what's this issue telling me? Is it stuck? Where is it stuck? How bad is it stuck? And then how is this impacting this person's life? And where do I need to start to make the biggest impact in their life today? There's so many things I've learned from Matt and Brandon as a doctor, but also just as a person. And I really appreciate their givingness to other doctors, their ability to just distill things down into what's the most important thing. Humble enough to learn, confident enough to perform. You don't have to have all the answers right away, but you do have to have the confidence to know that what you do is going to get you to the answers. The diagnosis is so important. Going in and being okay, the plan for today is this. And then what the problem is from a diagnostic perspective, whether it's tendon, bone, or cartilage, adhesion, nerve entrapment. When you can have that confidence that this is what we're doing, this is how we're going to accomplish it, you're not wasting your time and energy. You're not wasting the patient's time, energy, and money. Literally in 3 minutes, a huge change. The person gets up, they feel a huge change, they move better, they feel better. It's legit because there's no other way you get results like this that I've found amongst all the different things that are out there. Be curious, challenge yourself, have fun with this, and be rewarded.